Papillomatosis. So the general characteristics. It's a linear DS DNA virus, it's non-enveloped, and the virus enters in an inactive stage, which causes a latent infection, and the virus becomes integrated into the host's genome. It's oncogenic, which means it causes benign small tumors, and it can't be isolated. There's no replication in tissue culture. It needs keratin, and there's a non-isolated diagnosis. So the general pathogenesis. The incubation period is 1 to 2 months. Infection occurs through trauma or erosion on the skin. Primary replication happens in the stratum basale. The virus then moves to the stratum spinosum. There is then an amplification of DNA and the virus moves to the stratum granulosum. There is then a formation of late proteins and then assembly of virions and the release of infective virions from the stratum corneum. It is a local infection. The infection, replication, and shed all comes from the place of entry. There is no viremia. The clinical signs are in the skin and mucosa only. For the epidemiology, it's spread through direct contact, iatrogenic, and mechanical vectors such as flies. So for bovine papillomatosis, the etiology is there's more than 20 papillomaviruses. There are the delta papillomaviruses, which make bovine papillomavirus 1 and bovine papillomavirus 2. Bovine papillomavirus 2 can also infect horses and cause sarcoids. There is also the epsilon papillomavirus, such as bovine papillomavirus 5, and the Zika papillomavirus, which causes bovine papillomavirus 3, 4, and 6. There's a predilection site for each genotype. 1, 2, and 3 are all over the body, 4 is intestinal in the mucous membranes, and 5 and 6 are on the udder. For the clinical signs, it's mostly on the head and neck. It can also be in the eye, the horn base, the ear, and the abdomen. It also causes nodules, which are millet-sized, greyish, and non-painful, and they're like a cauliflower-like lesion. The disease is benign. It heals itself. The problem only occurs in secondary infections. For histopathology, expect to see epithelial hyperplasia, and the stratum granulosum and spinosum are enlarged. The diagnosis is a non-isolated diagnosis. You can do PCR. IF and IHC can also be done for tissues. For treatment, you can do surgical removal, but only if necessary. Otherwise, you can burn or freeze them. And for prevention, you can do an auto-vaccination. For equine papillomatosis, this affects animals under 3 years old. The etiology is there's equine papillomavirus 1 and 2. They are not problematic and there's easy recovery. There's a spontaneous healing. They cause small benign nodules on the head and neck. They are spread iatrogenically, most commonly through a bit and a twitch. For equine sarcoids, the origin is the fibroblast. The etiology is they're caused by bovine papillomavirus 1 and 2. For the epidemiology, mechanical vectors can play a role, and genetic factors. They are not transmitted between horses. The pathogenesis is the same. The replication is stopped when this virus gets to the horse. Late proteins form, but there's no infectious virion, so it can't be spread. The predilation sites are the head, abdomen, and thigh, and it's very aggressive. It can also affect the hoof. For canine and feline papillomatosis, it's not a problem and there's easy recovery. Most of the papillomas occur in the oral cavity and genitalia. There's spontaneous healing around 2 to 6 months and it affects young animals. In human papillomavirus, it's asymptomatic and it can increase cervical cancer risk. These cancerous ones are human papillomavirus 16, 18, and 31.